Welcome to American Med Spa Association podcast, Medical Spa Insider. This week, AmSpa founder Alex Thiersch is speaking with Bobbi Bullock, certified nurse practitioner, BSN, RN, RNFA, MSN, FNPC, and owner of Bobbi Bullock Medical Esthetics.
Okay, and welcome. This is Alex Thiersch. Welcome to Medical Spa Insider, the podcast put on by the American Med Spa Association, where we bring on entrepreneurs and providers and business professionals and influencers and all the same from the medical spa industry. And we talk about relevant topics. We learn about folks and what they've done to build their practices. We are very lucky today to have Bobbi Bullock from Boise, Idaho, who owns Bobbi Bullock Medical Esthetics. And currently, you just mentioned two locations. One was just opened very recently. So first of all, congratulations on that. And thank you for joining us, Bobbi. Appreciate that.
Thank you very much for having me. I'm looking forward to this.
Yeah, no, we've got a lot to talk about. You've been in the industry for a very long time. You're a nurse practitioner by training, in addition to a bunch of initials behind your name, which I will have to translate for folks eventually. But then you've also, really been a seminal part of the industry as far as training goes. You're a top trainer for Allergan, and I think some of the other injectable companies as well. You've really had a solid impact in the industry. You were asking me before we jumped on if I remembered where we met. And I didn't at first, but now that I've been thinking about it and talking, I'm pretty sure that I do. But let's get to that. First of all, give me the answer to that so that I can see if I'm correct. And let's get a little bit about yourself.
Perfect. Well, first of all, thank you for having me on. This is a wonderful opportunity. And I love sharing insight and pearls to augment our profession and our industry. And really, collaboration is the key to success, and anything that we can do to share our wisdom and our pearls with other people, other injectors and owners is really my goal. So the first time we met, I was a brand new key opinion leader, and I had done my first podium presentation at AmSpa, and I was invited to the key opinion leader dinner that night, and I had stars in my eyes, meeting everyone for the first time. And we were invited to this dinner in Vegas, and you and I were randomly sitting next to each other, and I don't know anyone. And I turned to you and I said, "And how are you affiliated with this group?" Yeah. And you said, "This is my conference," but you were a gentleman about it. And I
think that was back during my long hair days too. Like that was I think when we first met, I totally remember that. It was, and because then we got to talking, and you let me in on this kind of really impressive business that you had built. And I remember this happens every year, and you happen to be the one that particular year, where it's like I always meet somebody who is often from a place like Idaho or a place that you wouldn't necessarily expect to have a ginormous presence. And you started telling me about your practice, and I was blown away by how big it was and how advanced it was. And I was just like, wow, this is crazy. So anyway, I do remember that now. So I'm glad that you brought that up. So how have you been for the last couple of years? Everything good?
Everything's great. Things are rocking and rolling. Idaho is the fastest growing state in the nation. There's a mass exodus from California and Texas, and Idaho is the go-to destination.
And Idaho and Utah, right? I'm telling you, you two guys, those two states are going like crazy.
It's been a very interesting ride. We're getting a lot of people that want their beauty, and they have very specific ideas on it. Kind of the balance between California and Idaho is a little bit different on the way we approach aesthetics, but it's been really fun, and I really welcomed the new opportunity.
Yeah, no, that's great. So when we met, and I want to say this was like 2021, maybe now that it's coming to me, 21, 22. You had one location. You've since opened another one. Tell me a little bit about your medical aesthetics practice. What type of clients you serve. And then I do want to go back a little bit also and get into how you started it, because that's an interesting story as well.
Sure. So we're downtown Boise, Idaho, is our flagship location. And I have 6 injectors and 3 estheticians, and then 3 cool sculpting technicians as well. So we have a big practice. We had 8 rooms, and our growth has been stagnant for the last 3 years because we're at maximum capacity. And to hire and maintain top tier employees, there needs to be opportunity for growth. There has to be. People want to continue learning new skills. So we were really put up against the corner to open a second location. And we're in downtown Idaho, and the sprawl is headed west into Meridian. It's the boom town of Idaho. It's suburbia. And I was lucky enough, the universe aligned, and I was able to purchase a second location and own the location. And it has parking and all the amenities that people are looking for. So we opened that on election day, which I do not recommend. And it's been really exciting. We've received a lot of clients that had stopped driving to downtown. For some people, the traffic, the parking, paying for parking, finding parking was just too overwhelming. And now it's very easy to go to the second location. And Meridian has welcomed us with open arms.
That's awesome. Yeah, it's interesting because when people are opening a med spa or starting out on their journey, their medical aesthetics journey, they often don't think about that kind of issue that you just brought up, whereas at some point you might outgrow your location. And it's not so easy to just expand, right? You have to, nor is it so easy to find another location. So when you moved, how long did it take you to get to the point where you were? How long did it take for Bobbi Bullock Medical Aesthetics to grow to the point where you were like, okay, we're bursting at the seams, we're stagnant, we've got to move on?
We produced exactly the same revenue, almost to the dollar, strangely enough, for 3 years. And so we'd been looking for about a year and a half, and we had different concepts. We were going to do it a little differently. And in the end, this location fell in our lap. It happened very quickly. And we realized we wanted it to look and feel exactly the same. So all the providers work at both locations. We decorated it the same. Everything is the same. And so that when you walk in, you're going to get the same Bobbi Bullock Medical Aesthetics experience, the same girlfriend experience. You can see providers at both locations. It's the same. So we didn't want to create a different feeling. We wanted people to, we call it welcome to your aesthetic home. And we're going to be and give the girlfriend experience.
So what describe that for me? I mean, I think everyone probably knows what that means, but when you say the girlfriend experience, what are you trying to convey? What feelings are you trying to convey, and who are you trying to attract with that message?
Sure. Well, first and foremost, we're medical professionals. So we have 2 nurse practitioners, 3 registered nurses, several licensed estheticians and medical assistants. So first and foremost, we practice medicine. But what we're trying to do is really allow people to come in and feel like we're all your girlfriend. Like this is a safe space. Like imagine an old-fashioned sorority house where you can come in, you're going to take off your makeup, you're going to point out your flaws. You know, this is where you look in the mirror and be like, oh, if this can only be different. You know, we also offer cool sculpting, or if this could go away. This is what girlfriends do. They talk about the things they don't like about their face and their body in an open and safe environment. And then we either say, okay, you're crazy. I don't see that at all. No. Or, yeah, I do see that. And let's talk about that. And we have so much fun. There's so much laughter coming from each room. Sometimes we get a little crazy, a little out of hand. And, you know, clients actually really love it. Sometimes they come in stoic, and my goal is always to win them over because we're real. These are real things and real emotion. And I've practiced so many forms of medicine, from life flight to ICU nursing, labor and delivery, gynecological surgery. And this is the most impactful, this girlfriend experience of what we're doing, because all those other professions, when an outcome happened, such as you saved their life, you delivered a baby, you cured their sinus infection, the outcome was met, expectation met. But when you give someone back their youth or their beauty or their confidence, that is not something they expected. And so it is outcome exceeded. And that is where this relationship, you build a client and a friend for life.
You know, I love that approach because, and to me, whenever we're talking to folks about who want to open their own practice, and they get a little nervous because they think, oh, there's so much competition. How am I going to distinguish myself? I think what you just described, though, that, you know, coming in and you feel like you're talking with your old girlfriends, where you can just open up about everything. You can be yourself. That really captures a feeling and an environment where that makes it very easy for someone to picture what it is they're going to get. Excuse me. And it makes it easy for you to attract the kind of patients that you want. I'm curious, do you have male patients?
We do have male patients, and they
Okay.
actually love the girlfriend experience because they are getting all the attention and they buy straight into it. It's
I'm glad to hear.
hilarious. It's
So
hilarious.
let's talk. I want to talk a little bit about your background and then get into what you've done in Idaho with building communities. But first, I want to talk about your journey into medical aesthetics. And it's funny as you talk, all this is coming back to me because I do remember talking about like life flight or flight for life. And how did you get into medical aesthetics? One thing that we know, which I love about this industry, is that just about everybody comes from someplace else, right? They're a nurse or the nurse practitioner, doctor, whatever it might be, from a different vertical, and they either stumble on medical aesthetics, they are a fan of it already, and they really kind of they join the industry and then fall in love with it. What was your journey like? How did you get exposed to aesthetics and what made you want to say, you know what, this is what I want to do, and ultimately leads you to open your own business?
You know, I have a very backwards story. So I'm in Boise, Idaho, and go back 14 years before Instagram. There's a few things on YouTube, but no TikTok. This just didn't exist. And aesthetics was really reserved for the plastic surgeons. I was
Mhm.
thinking back, there were 5 bona fide med spas in Boise. That's it, really. And I was doing corporate medicine. My last job was gynecological and obstetrical surgery. So delivering babies, C-sections, and gynecological surgeries, hysterectomies. And I realized that corporate medicine was broken. And all the hospitals were buying up different practices and really changing things away from that family focused, patient focused medicine. It was turning into corporate and it didn't feel good. It didn't feel right. And also, they were firing people right and left that had been working at these clinics, these old clinics for 20 years because they were changing the name and bringing on corporate. And you'll learn about me. I have a big mouth and strong opinions. And I stood up and I said, this is not okay. You can't do this. You can't treat people this way. You can't take away their livelihood. And they said, oh, yes, we can. And you are fired too. So I am an A+ model employee and student. I've never been in trouble with the law, with my job, with school. So this was shocking. This was an ego. I was
Yeah.
devastated, mortified, and embarrassed.
But
Uh,
you know, it also kind of reinforces everything you were saying about your feelings too. Like, right? It kind
yes,
of doubles down on what you're thinking.
exactly. And so I was stuck. I was also a single mom with a 14-year-old son, and I had about $85,000 of student loan debt. And now I have no job and I'm not hireable back. There's only 2 hospitals in the town. I'm not hireable back at one. And
Mhm.
so I really didn't know what I wanted to do. I was stuck. Corporate medicine was just broken and failing. And so I hired an intuitive life coach, and she really helped me. I gave her my last $3,000, and it was a 3-month program. And I really worked it. And it was a turning point when she said, tell me about your best day. And I'd been to a spa one time on a Groupon for laser hair removal. I had never had Botox. I'd never had filler. This is 14 years ago. And but when I went and had that laser hair removal, I was like, what is this place? This is like a nirvana. Everyone is nice and pretty and it smells good and it's clean and it's beautiful. I just couldn't believe it. And so my coach is asking me, and I was like, I was crying because I was all sad. I'm like, well, I would go for a walk and then I'd go to the spa. And she's like, why the spa? I'm like, because they're nice and pretty and it smells good. And she goes, well, why don't you go work at a spa? And I said, I'm a nurse practitioner. What would I do at a spa? It never occurred to me. So I Googled what can nurse practitioners do at a medical spa. And
Mhm.
so came up with Botox. I know this is obvious land now, but this was not
Yeah,
obvious
it
land
wasn't at the
then.
time. No,
People
you're
were
right.
not getting Botox and filler. And so I had to be really, really clever. I had no experience. I had some dermatology experience as being a family nurse practitioner. And I got on the community college, and there was a course, a week-long course for estheticians on
Mhm.
acids and peels and some light therapy. And so I was like, I'm not an esthetician, I'm a nurse practitioner. Can I take this course? And they were like, okay. And I called Allergan and wanted to open an account and get training. And they said it's going to be $3,500. And I didn't have $3,500. And so they made a deal that I would get free training, I would pay $3,500, and I would get the product. And so I had one training. I had no mentor. I had no one I could call. I had no resources other than my old anatomy book. This just was not available on Google. And so I took exceptional notes. And, I had that line of credit for 3 months with Allergan. And when I was at 2 months and about 25 days, I was like, all right, I got to get the needle in the face. And so my husband put it out on Facebook for some friends to come in and just get it at cost. And so my very first patient came in and I injected Botox around her eye and she immediately fainted unconscious. And I thought, all right, I have hit a blood vessel. It went straight to her heart. I've stopped her heart and she's dead. But she's unconscious. So take her pulse, she's not dead, bring her back. Everything was fine. But this is before we had Hylenex. This is before we knew anything. This was just when we had Juvederm Ultra, Ultra Plus, and the nasolabial folds. Nothing else. And the glabella, that's it. And so no guidance at all. And luckily I'm clever and I already had 17 years of medicine behind me, again, with my last job being surgery. So I really did understand the muscles, the tissues, and the planes. And I just one step forward every day.
So that must have been terrifying, though. One of your first patients just all of a sudden.
Terrifying.
Yeah,
Terrifying.
because
Exactly.
oh my God. So then following that though, for how long did it take you to get going? And then that's one question. And then everyone always asks me there's a ton of folks who are in your position right now. And it's different now, like you said, there's a ton of resources out there. There's a ton of places to get trained. It's still expensive though, so you still have to deal with that. But how did you go about without a mentor, without working under somebody? How did you go about figuring out what to do? Not only how to inject safely and properly, but how to run a business and how to do that.
Yes, I wrote everything in my purple sparkle notebook. That was my ledger, and I just used the square to take money. That was all the bookkeeping I kept on the business side. I opened up a business checking account, and all the money went into that. I kept the business pretty simple. I didn't have any marketing. My husband started a website for me, and
Right.
my room was inside of a hair salon. So I found things that I could do easily. So while I wasn't proficient in that, I was proficient in microneedling, drawing blood, doing PRP. That was just barely emerging. I learned how to do dermaplanes, basic chemical peels. And I would make them really beautiful and feel good and, add some massage. And so I just added whatever I could to start this. And if I only made $200 a day, I know this sounds crazy, I could pay my bills at the very, very beginning. And so that was my goal. And, retaining clients and really taking these before and after pictures, that's how I learned. We didn't know anything. No one was injecting the cheeks. All I was really doing were folds and lips.
Right.
Really looking at before and after pictures and being honest with the patient. I always ask, how was your healing? Were you a trauma victim? Because I always want to validate their experience because that's real to them. And then I'm like, how do you like these results? So really working and being honest and taking before and after pictures. And I started this early on that I guarantee my results. So first I had a great relationship with my Allergan rep. I'm like, this is my job. I have no other job. No other side hustle. I'm going to make this work. And so we kind of had one of these. And I also said, I will be Allergan loyal because I know that's important to you. You give me everything. I'll give you everything in exchange. And so if something was off, I would change it and fix it at no charge. And so I really built a reputation because most places don't do that.
Right, right.
And that
Yeah.
I'm going to
It's all
guarantee
about the
you'll love
experience,
it.
though. Like that's what you did. I mean, you this is fascinating because you recognize what made you feel good about going to a spa,
Yeah.
and you transferred that into making your patients feel good. But I also really appreciate and like the fact that, you didn't do things that you weren't proficient at, and you just did what you could do. But that's enough if you make the patient feel good while you're learning other things.
Right. Exactly. That girlfriend experience. Lots of laughter, lots of
Yeah.
silliness. And
And you mentioned corporate healthcare and with a little bit of disdain, which I totally get. Did any of your lessons though at the hospital help you when you were
yes.
talking with patients?
I
And
feel 100% I wouldn't have been able to set up the successful spa without having that hospital experience. I really dissuade nurses and providers to go straight out of school into medicine. You need to understand your hand behind the needle, sharps, bloodborne pathogens. I mean, I knew how to set up a consent, how to, I already knew all this because I'd been doing it. And so that set me up on the right stage. That set me up on the right platform, so that we were going to have patient safety. I knew, don't touch your face. Of course, back then we were like, let's put some makeup all over it and send you home looking really
yeah.
good. And just clean it with alcohol. Things have definitely changed.
I'm Kathy Christensen, President and CSO of AmSpa. Don't miss Medical Spa Show 2025, April 10th through the 13th at the beautiful Wynn in Vegas. Use code Medical Spa Insider MSS25, all caps, as a promo code when you register at www.medicalspashow.com. See you there.
Promo code expires on April 10, 2025 at 11:59 p.m. Pacific Standard Time. Promo code only applies to the primary registrant. Promo code cannot be applied towards additional attendee registration and cannot be combined with any additional offers. Discount only applicable to new MSS 25 registrants.
Yes, they have. They have. So, you just had a room in a salon. And obviously you're doing what you can. That's a great way to get going, and you're learning and you're training. I presume you've got, Allergan is training you. That's a big difference though from going from that to a fully booked, fully established medical aesthetics practice that can no longer see new patients because you're so busy. What was kind of and I know there's a lot that goes into that. Number one, how long did that take? And was there a moment where you kind of remember thinking, this is gonna work. I feel like I'm really onto something, and I'm gonna dive in with both feet.
Absolutely. I love education, being a nurse practitioner. Education is my background. So I had an idea to have an educational event. I actually called it mobile Botox parties. So we had them at the spa, and I created a PowerPoint. So I went back to, what do I know? What do I know to be true? I created a PowerPoint about Botox and my Juvenile Ultra and Ultra Plus, what they can and what they can't do, how they're made, what to expect, with some of my before and afters, and then my credentials. And so people would come into the spa. So it was a medical place. And then they would get a collective discount, and they would be so much fun because, again, it's the girlfriend experience. And all I would inject at these events is Botox. And if someone wanted filler, then we would book it down the line. And then everyone would get a collective discount. And people loved that because there was a barrier to entry for Botox at that point. It was very expensive and people didn't know where to go. I was already a nurse practitioner in Boise. A lot of people knew, and I grew up here. A lot of people, I actually delivered their baby.
Mhm.
And so I was a known entity for a lot of people, but not everyone. But I credentialed myself as a healthcare provider. I knew what I was doing. I had the backing from Allergan, even though I didn't have any sort of a mentor. But and I also said I'm not going to get into something that I can't get out of the
Mhm.
beginning, at the beginning.
Mhm.
And that leads into some other things.
Yeah, well, and but what does that mean? You're not going to get into something you can't get out of.
So we were all very naive when we first started injecting
Yes. You
filler.
almost have to be, right? You almost have to
Yep.
be in order to be silly enough
Exactly.
to start a
Like,
business.
"Oh, this will be fine. We'll just see
Yeah.
what happens." A
Yeah.
couple of times I over injected some filler, and again, did not have Hylenex. did not, we had heard of vascular occlusion, but I didn't know anyone that it happened to. It's kind of like when you go to surgery, you might die under anesthesia. I didn't really know what is the prevalence, what is the problem, what's going on. And I'd never seen a granuloma. I'd never seen anything bad happen,
Right.
really all roses at this point. And so when I was doing these procedures, at one point, once my business started getting big, and you had asked me how I was doing. The first year I did $17,000, and I was pretty darn happy with that. My overhead, my rent was $300 a month to the room, and I had no marketing money, nothing. I was just getting clients from the hair salon. They'd be like, "What's going on over there? That's new." And they called me Cinderella because the room I rented used to be their broom closet. It had no windows, and I decorated it just really cute. And it was so small, I couldn't even walk around the exam table. I had to kind of maneuver around it. I also aligned early on with a CPA, and that was great because I have no business background. And he really helped me transition. Once I had hit $64,000 in my second year, he said, "You're ready to be an S Corp." And so he really helped me understand the taxes. And then I brought on my key player, and I showed her my Sparkle notebook, and I said, here's the ledger. And she's like, "This is a nightmare." And I said, "And here's the P&L. And she's like, "That's not a P&L. And I'm like, "Yeah, there's the profit and there's the loss."
Yeah, it's all there.
And her name's Summer, and I couldn't have done this without her. And I brought her in as a partner, and we did this together. And so I couldn't pay her anything but $15 an hour with a maximum of 5 hours a week. I had no money at all. And she earned some sweat equity, and now she is a vested partner with me.
That's exciting. So then again, you're at some point you decide you're going to move. I want to back up a little bit though, because part of your background, which is interesting, which I didn't know until today when I was reading about you, is you have this a condition that you've managed to overcome, and I didn't even know this was a condition that was out there, but I would love to hear about that. I tried to pronounce it and I made a terrible effort at it, so I'll let you do that. But then tell us what that is. And it seems almost like it's not something you could deal with as an injector, but you've obviously managed to do it.
Yes, it's called prosopagnosia, and it's facial blindness, and which means that I don't recognize people's faces. So if you suddenly showed at my house right now, I would not recognize that it's you. So I have to meet someone about 10 times in a short period of time, and I have to really look at interesting things on their face. So maybe the gray in your eyebrow, something unusual.
Actually a scar, but that's fine.
Yeah, something that catches my eye, good or bad.
Really?
And often it's the intonation of the voice. I have a very acute ear. I speak several languages because I can hear intonation. So I've developed these other skills to offset this. I've had this my entire life. It's familial. Several people in my family have it. Mine's the most extreme, and it goes to places and objects as familiar as well. So I get into any gray SUV that has its door unlocked, and I get in and I'm like, "This is not my car." And then I get out and I'm like, sorry. I drive past my house at least 3 times a week. If there's snow or leaves or someone parked in my yard, I don't recognize it.
Now, is this like a neurological condition or is it something with your eyes? Like, how does that? Do you know?
You're born this way.
Okay.
It's actually more prevalent. A lot of people have different versions of it where they're like, "Oh, I can never remember a name. Oh, I can never remember a face." They have different, or "I'm always lost." They have different versions of it, and they just don't realize it. So Brad Pitt, Alan Alda, they also have it. We're in a little club.
So if you when you have a new patient come in and then they come in again, you literally won't recognize them as being a repeat patient. You have to associate other things, whether it's something that's a distinctive characteristic or whatever that is.
We have a whole protocol because I'll tell you what, no one wants to be unforgettable. It really hurts their feelings, especially after we had such a girlfriend experience. And the thing is I don't forget you, and I don't forget the energy I felt with you or what we talked about, but I can't put your face to the rest of it. And so before we walk in the room, I always work with assistants. They come out, you know this person, they've been here before. They give me all the cues. I have it written down. They just had a wedding. And so then I walk in and I'm like, hey, how was the wedding? But it can be really bad. Sometimes my assistants will forget or they think I know them. And this is how bad it is. A couple of ones. My old boss my last boss I ever had, I'd worked with her for a year and a half and I'd only seen her professionally. And she was at the office in yoga clothes and suddenly she dropped dead in front of me and I did CPR and I was working with Summer. She called 911 and then we're doing CPR for an hour and she ended up dying.
Oh no.
So I said to Summer, can you please go call the owner and tell her that someone just died here? And she's like, that is the owner. And I had no idea. I mean, was like looking in her eyes, just breathing. So it's very, very severe. And I'd worked with this person every day for a year and a half, but she had her hair in a ponytail and some yoga clothes on.
That's crazy. So when you're like seeing somebody, even if you've seen them, and I'm sorry to dig into this, it's fascinating though. You're literally kind of relearning. It's like you're talking to them for the first time within
every
terms
time.
of what you're
and I have to get more cues. And if they seem overly familiar, or sometimes I'll walk in and I think I know someone and I'll give them a big hug and they're kind of a little bit startled. And then my assistant will say, and let me introduce you to Jenny. You've never met her before. I'm like, well, hi, we're just friendly around here. So
that's awesome. Wow. That's crazy.
You know, I didn't used to share this because it was a little embarrassing. But people that have been around me, I really don't recognize them. I really don't, unless I've seen them, like I said, about 10 times. But I've used this as my super skill. So we all have skills. We all have senses. And because I don't have that, I have different senses. I can see patterns and specifically symmetry, like salon. So I can see things that other people can't see. And so from this, as I'm injecting someone's face, and I inject full time and I teach full time. So this is something I do every time. I've just been so curious why one side is harder to inject than the other and what I keep consistently seeing. And so I went back to my labor and delivery days. There's one thing that every single person in the world has in common, and that is that we gestated inside of our mother. And that Mother Nature has us in a very specific position so that we can have a vaginal delivery. Every person in the world, male, female, whatever ethnicity, we have that in common. And so if we have that in common, I was really looking at the face. So when you're in the pelvis, this is when actually all the bones are forming. We're having osteogenesis, and then they're very malleable so that you can slide underneath that pubic bone. So the maternal the fetal face is pressed in the maternal spine and pelvis on the left side of the face, not only superiorly, but also laterally. And so what that does, and it depends on how rotated the baby's head is. Sometimes it's here. These are the most symmetrical people. Sometimes it's here, average symmetrical, and sometimes it's here, and sometimes it's here. So if you think about it, when you have that consistent pressure, the left cheek is actually going to be more contoured than the right cheek. So you're going to see more contour. This right cheek is actually going to be heavier. The right cheek is actually going to represent what you would have looked like had you been born more in a bubble because it's cushioned with amniotic fluid. So
that's what it truly is supposed to be, kind of nature.
Yes.
Gotcha.
And the right upper lip, and the viewers, as you're listening to this, you're going to be like, oh my gosh, you're
they're going to be staring
right.
Like,
so the heaviness of your right cheek pushes on your right lip and rolls it under. So when people look at their lips after you've done it, they're like, can you just do this? They want it up. And then the bottom right lip is square and beautiful. The left smile is longer and thinner, and it pulls laterally and sometimes superiorly like this.
Mhm.
So this side, when you're injecting lips, you really have to look at both sides of the face and know that you're going to need more product on the left side. And when you smile, you're going to see more of the left gum line. And then the left nasolabial fold is actually going to be heavier and sharper on the left-hand side, and the right is going to be heavier. So
Mhm.
lastly, the right jawline is squarer and heavier. The left jawline, because this is how it was in there, is going to be more linear. And the chin, you might even be missing part of the chin on the left-hand side. So this is going to be linear and with less weight. And then the last part, if you feel where the bones fuse on your temple, if you feel on the left side, it's more pronounced on the left side. It's sharper than the right. And so you're actually going to need more filler in the left temple. So I
Mhm.
realized that these things are consistent. Even if people are like, oh, I was a C-section, you were left occiput anterior at some point in your gestation and for most of it. And so this is
Mhm.
about 99% true. I'm doing a clinical trial on this right now. And and I filed a patent actually how to correct this, because if something is consistent most of the time, then we can have a consistent correction most of the time. So
Yeah, I was gonna ask you. So like what's the takeaway from that? I mean, you're able
yes,
to figure this out, which is I think incredible. So what's the result?
sure. Well, we teach anecdotally. It's not scientific and it's not mathematical. We teach inject 50-50. Everything
Right.
is 50-50. And then the talented injectors, they can see the asymmetry and they can correct it, but they can't reproduce it, articulate it, or teach it. It's a feeling. It's an intuition that they have because they have that artistic eye. And so
Mhm.
I've divided the face into 6 zones, and one side will actually get more than the other. So logic would tell you that the right heavier side needs less than the left skinnier side. That's what logic would tell you, right? It's
Mhm.
actually the inverse because our eye sees contour before it sees lack of contour. So the right has less contour and the left has more contour. So you have to add more contour to the right. It doesn't matter if it's sticking out wider. That's not what our eye sees. Our eye wants to see the equality of contour. So the right side actually needs more.
Mhm. That is fascinating. Have you run into anyone else who's kind of
No
noticed this?
one in
Or were
the
you the first?
entire world,
Wow.
the entire world.
And
It's
what's the reaction of other folks, like clinical trainers when you talk to them about this?
they're
What do they tend to
shocked.
get it? Are they shocked?
Yes, yes, they do. And it's been really exciting. The community is really excited. They've given me a lot of accolades. I've spoken at 4 conferences, including AmSpa, about my findings, and I'm patenting actually my second patent shortly. And this is going to, I humbly say this will change the way the world injects because this is scientific and mathematical in my clinical trial. We'll prove it.
Well, and it's like I've seen, and again, this is coming from I'm a lawyer and certainly have no business talking about injecting, but I've seen whether it's charts or the way that Allergan or some of the other anatomy books, they try to break it into that zone so you can have that symmetry. Um, but I find it really interesting that you can almost trace this back to something so that because it kind of gives you a starting point. Like this,
Embryology.
yeah, like this is kind of what this is how it developed, and it really allows you to start kind of going back and unpacking and then repacking,
Well,
figuring out how to do it. So that's crazy. Congratulations.
thank you. Well, I love that we have built this business. This wasn't a business, and we have built aesthetics and the innovators. There's a lot of us out there have really taken the bull by the horn and figured out a lot of things. And this is just that next step. So instead of injecting anecdotally, now we
Mhm.
can inject scientifically and mathematically.
That's amazing. Do you have a book? You should write a book on this. I mean, or
I have a
some sort of,
patent. I have
yeah,
a
but
US patent.
I mean, we gotta get like get you on, Oprah or something. Not even sure Oprah's still around though, now that I think about it. I do want to talk about because one of the things that you mentioned that I found super interesting is um, when you started, there was no Highland X, right? You didn't have anyone to rely on. There wasn't even probably extensive protocol for how to deal with occlusions, things like that. And one of the things that you've managed to do, which is really impressive, given that you are a nurse practitioner, not a plastic surgeon or a cosmetic dermatologist or any of those, the core four specialties, is you were able to create some sort of a community to help with the ability to deal with complications, to learn things like that. I would love for you to tell the listeners a little bit about how you did that and what that is so that they get an idea.
Absolutely. So when my business started getting big, I thought, wow, I'm really vulnerable. I'm exposed here. If I were to go, if something bad happened and I would be on trial and I just couldn't really look someone in the eye and say, I was prepared for this, or I really knew how to undo this. And so again, in Boise, Idaho, really limited resources. So I knew I wanted to have on my team an eye surgeon, a face surgeon, um, and someone who understood ultrasounds, et cetera, vasculature. And so I called the offices and of these places and explained who I was and that I was forming a coalition. And could I please have the email of the physician? And 4 people gave me the email. Everyone else was like, no, we're not interested. So 4 people gave me the email and 1 person responded. And actually 2 people responded. One said, no, thank you. One completely ignored me. And then one really wasn't sure. And then the other one was enthusiastic over the top. And he was an OG. He was actually had already sold his practice and was just transitioning the new guy on and staying on another year and a half. And his practice was 3 blocks away. And he's like, I love this. I'm coming over right now. And he was an occupational plastic surgeon and did a lot of facelifts. And he came over. I gave him a tour of my office. And he was like, this is great. And, he can see that it's professional, that, I'm following medical guidelines, and that I wanted to form a community that could really help each other. And he's like, so what do you want from me? And what is this? And I said, well, first, let me tell you what I can give you. I can help train you or your staff how to inject and how to inject Botox, how to do an assessment. And so first I offered up my skills. What did I have to offer? What did I have to bring to the table? And then I said, I want someone that can perform surgery, that if I have a problem, if I have an occlusion, that can help me troubleshoot this. You know what the inside of the face looks like. And also, this was before we were doing cadaver courses. I said, I want to watch you do plastic surgery. I want to see what this tissue looks like and how it acts, how you perform a plastic surgery, a facelift. And he was like, this is great. I'd be happy to. And so I watched probably 10 facelifts, which was so helpful. And then he sent his predecessor over, an MD and a big guy. And I taught him how to inject, and he followed me around, and it was cute because one of my clients was like, who are you? And he said, oh, I'm learning from Bobbi. And the client goes, oh, okay, that makes sense. Okay. And, here I am teaching the MD. And so, we did this back and forth, and we really learned a lot. And so it got out into the medical community that I was a legitimate person and that this was being symbiotic. And also, I don't do surgery. And so if I watch you do surgery and you run a tight ship, I'll refer clients to you. So, talk about really win-win, right?
Yeah.
For training, this is
sure.
a steady feed of people I've already vetted that are good for your surgery. So then an eye surgeon, he was like, all right, I heard from Dr. So-and-so, let me meet you for dinner. And so we met and talked it through, and he was like, okay, I'm on board. So now we had 2 people. And then one I never heard from. And then the last one, again, slightly declined. So everything is going great. We're really helping each other. And then there's the one fateful day where I had a vascular occlusion. And of course, I was injecting myself. We're not supposed to do that. It's gauche. I do not recommend it. But I did it. Volux in my chin. And it was the first time I could not undo what I had done. And I was like, dang it. And of course, it's a Sunday. And so I had a vascular surgeon friend. I called him and I said, I have a vascular occlusion. And he's like, how do you know you have a vascular occlusion? And I'm like, no, I know I have one. And, he was a nice guy. He's like, I'm sorry, I can't get involved with this. And I'm like, okay, like,
Too
what
bad.
should I
Yeah.
do? And he's like, I would just go to the ER. And so I was really thinking about this, and my other guy had retired, and the eye surgeon, I didn't know if he's going to be my best foot forward. And so I had just met an interventional radiologist a month prior at a Christmas party, and he's opening a med spa. He gave me his number. So I called him and I said, hey, Carl, what are you doing? And he's like, playing golf. And I said, is it a good game? And he's like, what's up? And I said, I need your help. And he's like, I'll be right over. So he was
Oh,
over
yeah.
there
Awesome.
in 10 minutes, took my ultrasound. So I had the tools, took my ultrasound, 5 minutes, fixed my chin. And then I was like, how can I repay you? He wouldn't take any money. And so I gave him cool sculpting, and then I gave him some trainings, and then he gave me some services. And so it just really worked well. And
Yeah.
he really saved me. He didn't disparage me. It's okay to ask for help. It is okay.
Yes.
And this is, going back to medicine, the morbidity and mortality conferences. You share what you did wrong and how you resolved it, or how you're not going to do it again. And there should not be shame in this. So
Right.
just to tie this up, I invited several med spas now to join. And I said, this is what I have. I have a giant stock of Hylenex. After that, I carry 30 boxes. I have a giant stack of Hylenex. If you have a bad filler outcome, it doesn't look right, send them to me. I'll fix it. I won't disparage your practice. The patient may or may not come back to you, but I'll fix it. And, I'm happy to help. How can I help in this community? Because we should share our knowledge and our expertise.
Yeah.
I have the luxury that I am trained from Allergan. I'm on the Accelerate team. I get to hear the best of the best of the best of the best of the best all the time.
So how many people do you have in your kind of network now? And we've talked about this with others. It's such an amazing thing. You almost have to do it. I think people are uncomfortable sometimes doing it for the reasons you've mentioned, but you almost have to, because you're not going to be able to solve every issue. Like, you're just not. And so you've got to have folks you can rely on who maybe have dealt with this, who can help. What is that? How big is your network right now and is everybody kind of in it for the same reasons? You all have Hylenex, you're all ready to help jump in if something happens?
I think being a trailblazer, saying that we're stronger in numbers, and that we can look at this as we would at the hospital, and we won't disparage, we'll help, we won't slander. Like, we all get ourselves into situations. And so I've really told my Allergan rep and also the Galderma rep, if someone needs help, please call me. I'm always happy to help. I'm always available, or I can help you find someone who can help.
Right.
And people borrow a lot of product from me because I keep large volumes, but you know what? I've run out of product myself and needed to borrow it. And I also have an ultrasound. And so if you're in a smaller community, like, one person's going to have all the Hylenex, one person can have the ultrasound. So you can tease out who's going to have what, and really maybe write some guidelines, some bylaws. This is a professional, safe space, how we can help each other with whatever skills we have. But I want to tell you the one time it didn't work out, and I'll close with that. So the physician that didn't want to join my coalition, that politely declined. Well, I guarantee all of my results at my expense. I'll even give all the money back. And, I've got a big staff, and I'm not doing all the services. And there was a service that didn't turn out how we told the patient it would. And it wasn't anything that I could handle in my hands. And so I called and I said, hey, this is what's going on. I want to send this patient to you. And of course, I'll pay your costs. And, they're like, well, we'll consider it. We don't know the liability. And, there's going to have to be some signatures. And I'm like, whatever you need. Perfect. And so got the patient taken care of. And I'm fine with whatever, but I was surprised. They charged me full patient price, and it was greater than $8,000. They charged me full patient price to take care of the patient. I'm falling on my sword saying, this happened, nothing life-threatening, right?
Yeah.
I want the patient to feel great,
Yeah.
right? They already spent money with me. I want them to feel great. And I just really thought it was very interesting. And the attitude towards me
Yeah.
kind of, I didn't feel good about it. They
Yeah.
were they were helping the patient, and they did, and everything turned out just fine. But at the end of it, I was like, thank you very much. I want you to know I'm an expert in filler and misplaced filler and filler occlusions. And if you ever have a situation that you would like some help, please call me. And I never charge to help. I'm really promoting community and collaboration, and that we should share our skills and expertise, as together we are stronger. And I sensed a change and a little bit of a backpedal.
Mhm.
And that really meant a lot to me. This practice, they didn't do anything wrong. They helped me, and I'm internally I'm grateful forever. They
They
didn't do anything
discharged
wrong.
you.
I want to be clear about that. But the sense of community and
Yeah.
collaboration, and that this is medicine and something will go wrong. It always does. You just haven't been doing it long enough. But I still, instilled that I'll help you anytime you need it. And I saw
Yeah.
them soften, and they are like, thank you. They got it. They got it. And so it turned
That's
out
awesome.
really beautifully.
That's a good story. It's something that, you've been to the medical spa show. I always tell folks who, when they are asking, should I go, should I attend? And I'm always just like, it's what this industry has built for itself. And I give kudos to you and a lot of others. It really is that sense of community and helpfulness.
Yeah.
It doesn't, not always, obviously there's going to be some exceptions, but like when you come to the event, it is very, very involved and helpful, and everyone wants to help one another. And I think the more we do that, the better. And you've got an incredible story. I wish we had more time. I would love to kind of dig more. I'll have to bring you back and talk a little bit more about what's next. But really, really grateful that you had the chance to come on. And I'll give you the last word, and also let folks know where they can reach you if they want to reach out. What's your website, Instagram, whatever you want to put out there.
Yep. So my website is bobbibullock.com. You can find me on Instagram, Bobbi_Bullock_NP. That's really the best way. You can also email me, but I'm not very good at email. Just so you know, I get owning a business, I easily get 75 emails a day.
At least, yeah, I'm sure.
Right. And so those two spaces are the easiest. And sometimes I have people that I don't even know pop in with an emergency. What would you do? And then I respond what I would do on Instagram. And then I'm like, you're going to be fine. It's fine. And then I never hear from them again. So I'm always happy to weigh in.
That's great. We'll have to, I think we can build on what you've kind of produced, because I think we need to do that on more of a national level, or at least regional, where we can have people where everyone knows they've got that network and that backdrop, because it's got to make you feel better, just kind of, more secure with what you're doing, because it can be, it's kind of lonely at the top when you've got your own business, and you've so this gives you a way to rely on other people. I think that's great.
I think it just really pulls everyone up. We're all medical professionals, that we should just share and help.
Well, Bobbi, thank you so much. I appreciate it. It's been really cool to talk to you. I'm going to make it my mission to make you recognize me next time. So I'm going to accent my eyebrow with more gray, or cut out another piece of it or something. But thank you so much. I appreciate it.
Thank you very much for having me. It was a real pleasure. Have a good day.
You too. You too.
Thank you to producers Madeline Mahler, marketing content coordinator who organizes, schedules, and handles our guests, provides topics, talking points, and guest bios to our hosts. And myself, Joe DeGuzman, technology operations assistant manager. I handle the audio and video editing, voiceovers, and tech. Kate Harper, senior digital marketing coordinator who makes all of our graphics and manages the podcast platform. Esme Uriostegui, senior social media coordinator who makes and posts all the clips of the podcast to our social feeds. Our music is by Ghost Score. Thank you for listening to or watching the Medical Spa Insider podcast. Please follow or subscribe wherever you listen to your podcasts, and subscribe to our YouTube channel for future episodes. For more information about the American Med Spa Association, please check our show notes or in the description below.